lot of the nerves are coming out of the cranium here, traveling down the spine, innervating along their pathway. The nerve that I'm mainly concerned about here is going to be the vagus nerve. That's exiting from cranium, and then it's going to travel down and it terminates in various organs. So it's basically the nerve that innervates most of the organs, primarily of digestion, that I'm looking at. So if the vagus nerve has been having to send a lot of signals to the organs from processing medications or from stress or from staying static in the stall, that nerve will be sort of working extra hard trying to get those organs to calm down. So you'll tend to see a lot of sensitivity around the exit point of the vagus nerve or to any of the organs along its pathways. So what I've been trying to do is just working in and around the brainstem and trying to free up any sort of restriction that that nerve could be experiencing right from the top down. This diagram is great for showing all the branches of the vagus nerve, demonstrating that it goes through the throat, into the heart, cardiac branch, as well as the lung, and then traveling onward into the esophageal plexus, through the heart and stomach, as well as into the spleen and the celiac plexus, which is getting into our digestive system, and then finally terminating down through the colon. Here I have outlined where the vagus nerve continues after exiting the cranium. As you can see, it travels down the neck anteriorly, giving off some fibers to the brachial plexus, and then it continues down into the thorax. It then travels through the heart, and we can see that it's passing just under the lungs and continues on its pathway towards the organs of digestion. So just palpating exit points of vagus nerve here. I'm going to give a little pressure on the right. Doesn't love it. And then I'm going to give a little pressure on the left. Definitely likes that a little bit more. So I'm just feeling for rhythm in the nerve and the bone and sort of going with the flow that I feel. And if I'm feeling a restriction either direction, I'm going to go the way that it wants to. So that would be an indirect technique where I am allowing the body to flow in the direction it would prefer instead of me adding a resistance or pushing it into restriction. So I'm going to go, it would like to go a little bit back, so I'm going to just continue pushing back. Getting a lot of eyes fluttering. Good. Okay. So now I'm going to start feeling down the cervical spinal bones to see if I can feel one side coming out more than the other. If she'll let me, I'm just going to come underneath her. So I'm feeling more tissue in my hand on the right here and a more bony prominence, so that would indicate that she would be left rotated through potentially C5, C6. I could also check her neck flexion to verify range of motion just by taking her head towards. So at this point there is resistance. I'm looking for her to match my body, so coming to 90 degrees, checking the other way. She's already doing it. So going into left rotation, much better than it was into right rotation. So if the vertebrae is rotated like so in her spinal column, that is going to be difficult for her to then turn into that rotation, which would make sense why the rotations are more difficult towards me if the vertebrae is rotated away from me. And easier to go into left because it's already sort of sitting in a left rotation. Now I'm going to go ahead and treat the C5. Okay, so just watch closely at the eye and the chin as I sink into the tissue of C5 and 6. She's telling me that might be a little too much, or that it's a little bit closer to the top where she's feeling discomfort. So I'm just going to go up to the top where she's asking. Bring her back into view. So she walked herself up to about here, around C2, C3. Got the eyes fluttering, a little bit of licking and chewing. I'm just holding pressure at C2 and C3. I'm really not doing it much mobilizing here. I'm just holding pressure at the tissue and waiting till I feel a release. Hit a spot here where there's a lot of congestion in the tissue itself, and she was getting a little bit stronger reaction. The eyes. Let the flies go in too. I was starting to feel a better rise and fall in her tissues as well as in the occipital bone there. So I released that as soon as I started to feel a bit better rhythm, and then Sparky started playing on the fence there and made her spook a little bit. So what I'm going to do is just continue down the C-spine looking for restrictions along the pathway of the nerves.